Okay, we're going to demonstrate the Graston technique for the Achilles tendon. Essentially what Graston does, it tries to jumpstart the healing process. When there's a delay of healing, healing essentially can't occur without some sort of inflammatory reaction. That's how our body sets off that whole healing cascade of events. When we're trying to elicit a healing effect, deep friction massage has been used for a long time. Graston came up with these tools probably 15 plus years ago to save our thumbs and save our fingers. So these are his latest tools of assisted mobilization, actually the sound assisted soft tissue mobilization tools. The sound being you can actually use the tools to help to diagnose and to isolate a fibrotic problem or a lesion. So when we initially start with the Graston technique, we scan the affected structure, or the structure we're assessing. So you just very lightly stroke up and down, feeling for points of noise. You can actually feel a crunching down through the Achilles. In some of our patients, you can actually hear the crunching, whereas in Lauren, it's not quite as dramatic as that. So you scan the tissue up and down the entire length of the Achilles. The research that's been done on deep friction massage, in particular on the Graston tools, essentially says that you can stimulate production of new collagen tissue. Collagen is what is the main composition of our tendons, our ligaments in our system. It also, research project says that you can, after the Graston procedure has been done, the strength of the tendon is actually about 30% stronger than the untreated side. So there's definitely some research behind this. There's definitely a good physiological response that occurs with the Graston technique. So when it comes to the actual treatment, after you've isolated your points of fibrosis in the system, you want to treat them. Okay? And according to David Graston, you don't want to be doing more than about 20 strokes at any one area. So if we're trying to treat both the lateral and medial side of the Achilles tendon, I would probably get in, isolate the most fibrotic areas, and you can use a combination of motions, up, down, forward and backwards. You can use side to side to see what exactly causes, what elicits that greatest reaction in the tissues. When you find the direction that elicits the greatest reaction, that's the direction you want to treat it, because that's the area of the greatest amount of scar tissue or fibrosis. So we would get in and treat. How much pressure you use, of course, is dictated by the patient tolerance, your experience, what kind of reaction you want to get, how much inflammation, reactive inflammation you want to cause. So I'd probably do 10 times here and say she's pretty reactive. She's not as bad over on this side, but I would go for maybe 10 swipes there, 10 swipes over here, and then same thing. 10 swipes over here, and then 10 swipes over here. And that would be essentially it. That would be a Graston treatment for the mid part of the Achilles tendon. That's good.